Vanakkam. The surgeon must have certain characteristics and develop certain habits and virtues which will guide him or her safely through the entire procedure of surgical management and not just the surgical procedure alone. He must be able to manage the entire team that he is leading and be a good leader. That brings us to understand that discipline and leadership qualities are the important attributes of any good surgeon. Now, looking for some interpretation of this in the 3000-year-old treatise, the Thirukkural, is a little far-fetched. But I was pleasantly surprised to find two kurals or couplets that were very apt for this topic. Thiruvallur could really put profound thoughts into simple words. And so we shall see in this video what it takes to be a surgeon. A clarification before I start off. I refer to the surgeon as he in most of this video, and that is mainly for convenience. There are some excellent women surgeons who have blazed paths of their own and are still continuing to do so. As far as the surgeon is concerned, there are two important qualities that he or she needs to develop: discipline and leadership qualities. Discipline is for the self. Discipline, which is a prescribed conduct of behavior that he or she develops to make sure that he stays on the right and safe path. Leadership qualities are to ensure orderliness in the team that he leads. Let us consider the first quality first: discipline. We all know the term discipline, but is it so important? Isn't just getting the work done by whatever means? Has Thiruvallur said anything about discipline in the Thirukkural? Yes, he has, and quite strongly at that.
ஒழுக்கம் விழுப்பம் தரலான் ஒழுக்கம் உயிரினும் ஓம்பப்படும் உயிரினும் ஓம்பப்படும்.
That is, ஒழுக்கம் விழுப்பம் தரலான் ஒழுக்கம் உயிரினும் ஓம்பப்படும். What does it mean? The word ஒழுக்கம் refers to discipline. Viluppam means benefits or excellence. Tharalan means will get you. Olukkam again. So this discipline, Uyirinum, refers to more than life itself, and the words Ombappadum means to be considered. So the Thirukkural says that discipline will bring progress in life and may sometimes be more important than life itself. Discipline means orderly or prescribed conduct or pattern of behavior, and this can be cultivated by instruction and exercise, especially in self-control. But this is again a little vague. What sort of discipline is required? And that too in a surgeon. Let us see what the surgeon must do to stay on the disciplined path. We need to understand first that when a patient seeks surgical help, either elective or as an emergency, all he trusts is the surgeon, not the assisting doctor or the nurse or the paramedical staff or the administration. Since the patient has put his entire trust on the surgeon naturally has the responsibility for the well-being of the patient. He or she has the primary responsibility for any outcome. How does the surgeon fulfill this responsibility? Performing the surgery skillfully and well is just not enough. There are many other factors. Responsibilities in various steps leading up to the surgery and after the surgery too. So let us see the various steps where the discipline of the surgeon will help in avoiding problems. Let us assume that the surgeon has examined the patient thoroughly, made a diagnosis, conducted the necessary investigations, planned the surgery after discussing with the caregivers and the patient, discussed the nature of the surgery with the anesthetist, made arrangements for the required instruments and suture materials, and thus completely made preparations for the surgery. He now has to enter the operation theatre and perform the surgery. Let's start here and see the responsibilities and the 9 important duties of the surgeon. The very first discipline in a surgeon is presenting on time to the operation theatre. Being punctual gives the surgeon a very calm mind, and as we know, a calm mind will have less of mishaps. It is just like driving. The more disturbed you are, the more chances of an accident occurring while driving. He is also calm and collected and can think of any problems that can occur and think of ways to overcome these problems. The second important duty is the pre-op checklist. He needs to check the patient details, the side to be operated if it's going to be a limb, and whether all the investigation reports are available. For example, an X-ray or an MRI which may be needed as a guidance during the surgical procedure. There is no point in running around or hunting feverishly for the MRI report while the surgery is being performed at a critical time. Then the anesthetist takes over to give the anesthesia for the patient, and he should not be disturbed at this time. The third important point is before the surgeon goes to scrub for the surgery, he must make sure that the positioning of the patient is good. It must be in a good position so that the surgeon can perform the surgery comfortably, not hindering the work of the anesthetist, and giving ample room for the assistant and for the staff nurse to help in the surgery. There are some patients who require different positions, and all these should be set correctly before the surgeon goes up to scrub. The fourth important duty is the application of attachments in addition to the IV line and pulse oximetry which has already been done by the anesthetist. We may need a diathermy earth pad, we may need an indwelling urinary catheter, and we may need a tourniquet to be used during the surgical procedure. So all these should be confirmed before the surgeon can scrub for the surgery. Then of course the surgery should be performed calmly and skillfully. There of course is a decorum that should be maintained in the operation theatre, and this decorum will make sure that everybody is in a peaceful state of mind that can think clearly in case of any problem that occurs during the surgery. A calm mind, a calm surgeon is the order of the day. Now the surgery has been completed. Before closing the wound, wherever it is on the body, it is the surgeon's responsibility now to do a pad count, instrument check, and check with the anesthetist about the condition of the patient. Only if everything is correct and comfortable, the surgeon can close the wound. After the surgery, the next important duty comes. Sometimes surgeons leave the duty of applying dressings to the assistant. This is something that I do not prescribe to. After a wonderful surgery, if the POP or the dressings are not applied right, sometimes the surgery itself may not work well. So, it is the responsibility of the surgeon to make sure that the dressings and the POP, if it is being applied, to be applied correctly. It is ideal for the surgeon to do it himself or at least oversee the dressings and POP being applied. Now the patient needs to be shifted out. Here again, an important duty of the surgeon is to ensure all the attachments are taken care of. The IV access should be good and flowing well. The urinary output should be good. The urinary catheter must be in place. The earth pad should be disconnected, and the tourniquet needs to be disconnected also. After the patient is shifted, the surgeon needs to make sure that the patient has safely reached the post-operative ward or the room and is comfortable. And he also needs to talk to the attenders who are waiting anxiously to receive news about the surgery. It is important to tell them what has been done and what is expected of them again. After ensuring that the patient is comfortable in the ward, it is the surgeon's duty now to make sure that the notes are written. The notes may be written by the surgeon or by his assistant, but it is the responsibility of the surgeon to make sure that the notes are legibly written and the details of the surgery are also mentioned in the notes. The duties of the surgeon do not stop here. He needs to take a good post-operative care. He has already seen the patient in the post-operative ward and he needs to follow up. The general condition must be confirmed. The hemoglobin level, the urine output, the blood pressure, the hydration and the general comfort of the patient. If the surgery has been done on the limbs, the vascularity of the limbs must be assessed. If the surgery has been done on the hand, the vascularity of the fingers must be confirmed. Any soakage of the dressings must be noted and corrected immediately. And routine dressings and follow-up must be done of the patient also. When he follows all these steps, he becomes a disciplined surgeon. But when a surgery is performed, there is a team that is involved. It is not only the surgeon who is performing. A comfortable performance of the procedure and good outcomes can happen only if the entire team is as motivated as the surgeon. And this team, which is going to consist of different types of people, anesthesiologists, nurses, paramedical workers, can be headed in one direction smoothly only if one person is leading them. Since the primary responsibility for the patient is the surgeon, he naturally has to lead the surgical team. But how is he to do this? Do we have any guidelines to show us how this leadership must be? Do we have to look far? Thirukkural has it.
அஞ்சாமை ஈகை அறிவு ஊக்கம் இன்னாங்கும் எஞ்சாமை வேந்தற்கு இயல்பு எஞ்சாமை வேந்தற்கு இயல்பு.
அஞ்சாமை ஈகை அறிவு ஊக்கம் இந்நான்கும் எஞ்சாமை வேந்தற்கு இயல்பு. The word anjamai means fearlessness or courage. ஈகை refers to generosity. Arivu refers to knowledge and ஊக்கம் means motivation. In Nangum, these four qualities, enjamai, a complete, வேந்தற்கு இயல்பு, qualities of a good king or a leader. So, a surgeon as a leader must be courageous, generous, knowledgeable and motivated. Courageous but not reckless, generous but not foolish, knowledgeable but not arrogant, and motivated but not aggressive. Let us see these characters and try to understand them. Now, the courage is for the surgeon to take bold, strong and stable decisions when needed for the betterment of the patient. And these decisions must be based on his or her knowledge, experience and available evidence in literature. He should also be bold enough to communicate the decision to the patient and the caregivers. When a problem or complication arises, the surgeon must boldly take the decisions needed to solve the problem. He should also protect his team and the members and make sure that things are sorted out. A kind heart does work wonders. That is what translates into what is known as empathy for the patient and his problems. Only when the surgeon understands the problem that the patient is going through, a correct plan of treatment can be made which can be customized for that particular patient. The surgeon needs to be, of course, knowledgeable. It is sometimes very erroneously thought that the surgeons need to keep operating and he need not know much of theory. This is far removed from the truth. Knowledge is the basis of all work, and in a dynamic field like surgery, which is evolving day to day, keeping abreast of the latest knowledge will make a surgeon much more adept. There will be times when morale may sag in the team that the surgeon has developed. It could be due to a failure in a surgery or a very bad complication. It is the duty of the leader to make sure that motivation is restored and work goes on as usual. The leader can use his own technique to get this done. A pep talk over ice cream and snacks or a team dinner. Complications can occur and will occur in spite of disciplined procedures being followed. A small lapse can also result in a major disaster. That is because no one has ever understood the human body completely. What we need to understand is that surgeons are not God. They are human beings who want to serve the people. But by virtue of being human beings, they can make mistakes. But it needs to be remembered that their motive was to do good for the patient, and the entire team was also keyed up to achieve this. To decrease the possibility of these mistakes, we can follow what Thiruvallur has said. Ozhukkam vizhuppam tharalan ozhukkam uyirinum ombappadum. And to develop good leadership qualities, அஞ்சாமை ஈகை அறிவு ஊக்கம் இந்நான்கும் எஞ்சாமை வேந்தர்க்கு இயல்பு. Thank you.